Hi everyone, welcome to the Link Senior webinar. We're going to get started in 5 minutes. Thank you.
Oh, you don't need to control here,
Okay. All right. Good afternoon everyone, and welcome to today's Link Senior webinar. Just a few housekeeping items before we begin today. This webinar is providing you with one free NAB, NCAP, and NCCDP CEU credit. To be eligible for those CEU credits today, you must stay on the webinar for the full hour, and the Zoom meeting room will track how long you remain in the room and will send that as a digital report to me. We are not able to provide CEUs to people who only join by phone. At the end of the webinar today, I will provide the required post-webinar survey evaluation link in the webinar room chat box, and I'm also going to send it to you through Constant Contact. via email, so please be sure to check your spam folder. You need to fill out that survey if you want CEU credit by midnight this Thursday, January 16th. And if you're not looking for CEU credit today, we still want your feedback. So please go ahead and fill out the survey as well. CEU certificates will be issued on Friday, January 17th this week by email. And please again, check your spam folder that day. And without further ado, I am going to hand it over to Charles DeVille-Morin, CEO and co-founder of Link Senior. Charles, take it away.
Thank you very much, Megan. Hi, everyone. Happy New Year, happy new decade, and thanks for joining us. I'm super excited about this webinar today, and we called it the State of Resident Engagement in 2020. And we're excited not only because it's part of this very successful webinar series that we've been doing actually for now more than 2 years. We've engaged and helped over 6,000 participants. But the reason why Link Senior is excited to be providing these is that we know by default that you on the line, anyone involved in activities, life enrichment, rec therapy, and wellness, we sign up for a job, we show up at work because we're passionate about helping older adults live with purpose, right? Being engaged in their life despite a physical or cognitive journey. But we're all very hungry for better education. So our approach, hearing from clients and other people, was thinking, well, how can we help and how can we further the discipline? So we started these webinars. As Megan was saying, we provide CEUs so some of you can continue to get the license and not have to leave the community they're building. But we're also very interested in attracting extremely talented people. So we've been blessed by having these different people on the screen here. And as always, like we've done in the past, we're very, very eager to hear from you who we should have on the line on these webinars. At the end of this webinar, we'll show what we have going on for the coming month, but if you believe that there's something that would be interesting to you and other attendees, please feel free to send us a line. Just a quick background on Link Senior for people who are not aware of what we do. In essence, I started the company more than 13 years ago, and we've been very blessed and lucky and successful in growing to become a resident engagement platform for senior care. We service and touch more than 41,000 lives in 43 states in Canada. And essentially, we help organizations like yours, staff like you, to engage people, again, older adults that live and that you serve. So with that, I did want to share one thing is our work actually was research, and it was funded by Baycrest, and that research study was actually published last September in the Senior Housing and Care Journal. And I'll come back to that research a little bit in the context of this webinar today, because that data, regardless of whether you use Link Senior or not, whether you're interested or not, this data helps us as a discipline show the value of our work. And essentially, the research study was able to not only correlate, that means show the implication of engagement on quality of life outcomes, but also clinical and financial outcomes. So let's get to the webinar today. What I'm very excited about, what I'm very excited to do with you is to share a little bit about some of the things that we see in terms of resident engagement. You know, we call it the state because we like to be very data-driven, so we'll share with you some data and where we stand as a discipline. We'll then focus on what's blocking us, right? We all wish for certain things, and the purpose of that part of the webinar is to see if your needs are the same as other people and how other people have been able to, quote-unquote, solve them or progress or improve that work. And that will be the third part of that discussion today, which is what, as a company, us, Link Senior, what do we see people do? What are some of the best practices and opportunities? So with that, you know, just a little bit about myself, just in the context of why I would be good in talking about this. One is, as some people Well, first of all, obviously, I like to say that I've never been scared of old people. I actually love working in this industry, in the aging industry. But when I started Link Senior, just prior to that, I had written my thesis on nursing homes from a social science perspective. And starting Link Senior, one of our partner and clients, one of the very first one, told me that I should become I should go through MEPAP, the certification to become an activity director, which is what I did. And in the process, started learning about other types of training. I'm a validation method worker, and I also went through the CDP training. I am actually on the board of the Validation Training Institute that promotes the work of Naomi Fowle. So I'm very passionate about the older adult, I'm passionate about dementia care, and I'm extremely passionate about how we engage the older adult. In terms of agenda, as I said, we're going to start with where do we stand with resident engagement. So in 2020, actually, we've made significant progress since I started this company, so a little bit more than 10 years ago. But I think that to give some context to that, it's really important that we understand what we do, right? So first question, what is resident engagement? I'll go through that. After that, I'm going to share some data that is nationwide data, and then I'll go into unique data sets from Link Senior that we actually finished compiling this morning, and we're hoping to show you so that we know how we're doing in it and where we're going in terms of discipline. I think the best way to frame resident engagement, the best way to frame what activities, life enrichment, and rec therapy or wellness is about is in the context of what's called the social determinants of health. So obviously that's a mouthful. Some of you might have heard it, some of you might not. I encourage you to just think and look it up because it's extremely timely. A lot of organizations are aligning their efforts in that perspective, and overall as a healthcare industry, most people are aligned on that. And essentially, it's great for us activities and programming staff because essentially what this social determinants of health concept explains is that throughout a healthcare journey, throughout people when they go through different systems, more than 70% of the outcomes that are clinical in nature, more than 70% are actually not based because of something medical or clinical, but actually psychosocial, right? Which is what social workers do there, and that is what activity directors do. And so essentially what this means is that it doesn't say that medical things or the clinical processes or the clinical work in our assisted living or memory care or nursing home is not important. It is important. People come because of that. But it says also that our work in programming, in resident engagement, can potentially influence more than 70% of the quality of the life of the older adult, right? So that is extremely important, especially if we think about, does our budget correspond to that? Does the resources we have correspond to that? And essentially, it explains why our discipline is probably one of the most exciting things that we can do today in the field of aging. To put this in context, especially in the aging world, we all know of the work of Abraham Maslow, but I think that to give some context to resident engagement and activities and so on, what do we do, right? So what we do is we help the older adult be who they must be, right? So this definition for me is one of the most beautiful definitions when it comes to our work, but also explains well to people who have no idea what is the work of resident engagement, right? So we help people, musicians, make music, and artists to paint and so on. We help them be at peace with themselves, but beyond that, be who they must be, right? And so if you put all this in context, it's interesting to see where we stand. And so this is where some of the nationwide data helps us show what are some of the gaps and some of the differences and why sometimes we sometimes feel that our work is difficult, right? As an industry, historically, and although there's been some progress, we don't staff enough, right, in this department. And this is an extremely challenging discipline because besides the fact that we don't staff enough, we know that our residents, the older adults that we serve, need us to stay engaged, right? To stay connected to purpose. Because more than 80% of them have some kind of cognitive change that precludes them from getting there. Often we're not helped with the family members because some of them don't visit us or don't visit the older adults. And obviously, we've talked a lot about medication, such as antipsychotics and antidepressants and antipsychotics, but one must always remember that medication gets in the way of us helping the older adults stay connected to their source of purpose. So that's, I'm not going to say that the job of an activity director is impossible, although sometimes I do believe it, but generally speaking, I think that it's a very difficult task. And these are the fundamental reasons why. Now, what does that equate to in terms of how are we doing? There's an old report, and unfortunately we haven't been able to find something newer, but there's an old report from the CDC that shows that in assisted living and nursing home environment, we don't engage our residents much, right? So again, it's 2015. We know at Link Senior that there's been some progress. We don't know how much, but it clearly hasn't doubled yet as an industry. So, in the context of the social determinants of health, in the context that our work can influence up to 70% of the quality of the life of the health of these individuals, right? Why is it that we're only providing 11 minutes in nursing homes or 20 minutes in assisted living? Well, again, we're not staffing much, we don't have the tools, and most of our residents need us. Now, this is the data that I wanted to share with you, which is exclusive to Link Senior, and again, I need to explain a little bit what Link Senior does, but one of the modules that we have helps the activity professional, the resident engagement team, track attendance. And so last year, some of you that were on our webinar last year might remember that we shared that across our client base, we saw different engagement levels, right? So on average, a person using Link Senior engages their residents 36 minutes in assisted living, 63 in memory care, 38 in nursing home. So for us, this was interesting because we obviously understood why in memory care we would engage our residents more, right? I mean, the main reason is that there's a higher need, but then we were very perplexed to see why does it dip in nursing homes. A lot of people say that long-term care residents are obviously in more quote-unquote need for help by their staff or collaboration with the staff. But why is it not much more than in assisted living? And why isn't it closer to memory care environment? And the main reason is that when we work in a nursing home, we might have less staff or less resources, right? And that's also shown in our this is also shown in our 2019 data. So you on the line are the first ones to see this slide that I finished this morning. We've seen tremendous progress in most settings, but again, a bigger need in nursing homes. So this is the data that I wanted to share with you. In assisted living, we saw a very slight progression. It was a tenth of a minute, so basically it kind of stayed the same. But what was interesting across our client base, so again, this is not nationwide data, we don't have that, but we did want to share with you that people using a product like Link Senior or Link Senior probably saw an increase, right? And that increase was very encouraging, although probably not enough, right? We probably want to see more than an hour and a half of engagement in memory care or 50 minutes in nursing homes. It is still a very good increase. And so in memory care, we saw a 46% increase. In the nursing home, we saw a 29% increase. And very encouraging overall, right, across the client base, year on year, we saw a 36% increase. So that's a third. Now, I think that with the experience that I have in the industry, I can tell you that the bulk of that acceleration is really happening right now. And when I started Link Senior, no one even thought about measuring a number of minutes per day or anything in engagement, 10 years ago. So, but I can tell you that a lot of people are in the process of implementing ways to find that data point or have already. So I highly encourage you to think about where do we stand if we don't stand anywhere, right? Where do we stand, and again, where do we improve, which is some of the things that I'm going to be discussing with you today. I think the last two components that I wanted to share with you is also recent studies. So on the next slide, I'm sharing information that some of you might have seen, which comes from an organization called ICAA. It's a Canadian organization with a North American focus, which looks at wellness-based models in senior living and senior care. And again, the Canadian, they have work in Canada and in the US, and I highly recommend you looking into some of their work. They were the first ones to promote the concept of wellness, right? This idea of different dimensions of wellness in our industry. And the data is great for us, right? It really validates not only the importance of our work, but also tells us where we are going in our industry. And again, you'll hear me say that every single day. Today, being an activity director is probably one of the most exciting things we could do, right? We know that our, on average, people that participate in our activities would live 2.6 years longer. That's pretty cool, right? But even more importantly, it also shows that as an industry, 60% of our communities will be working towards wellness-based model. And we know that activities, programming, and resident engagement is foundational, essential to wellness. The last piece is a little bit about our study. So although this is a Link Senior study, I'd like to explain it a little bit because it matters for us all. When throughout the year of this study, we analyzed data of engagement, whether it was through Link Senior or with outside of Link Senior. And some of our work was trying to understand what is the impact. Now, the sample was over 300 participants, so very meaningful. And the data was very rich because as Link Senior integrates with point-click care, which is the health record in place in the communities where the study took place, we were able to provide the researcher data sets, two data sets that were very rich. One was the engagement, right? So how each older adult has been engaged by which staff and towards what purpose and what was done. And then the other data set was obviously the record of the resident, so the health record. So that means anything clinical and beyond. And so, if I'm an activity director or a rec therapist or a life enrichment coordinator, if I see that data, obviously, it has a broad appeal because it means that regardless of Link Senior, people that are highly engaged will be also at less risk of isolation, right? We saw this 20% increase in social engagement. What's also extremely exciting, and it's the lowest figure here, but it's probably one of the most meaningful, is that we also know that residents, older adults that are more engaged, see an increase of 3% in cognitive functioning. Now, for people that might be less familiar with this notion, it's important because when we look at aging, when we look at the older adults, it's called I hate the word, but it's quote unquote a frail population. And we know that most people that get to the assisted living, the memory care, or the nursing home environment, they're going to decline. So seeing a maintaining of cognitive functioning is good. 0.5% or 1% is excellent, but 3%, we never expected this. So it's huge, showing what activities, programming, resident engagement can do. And obviously, we saw clinical outcomes. We expected these. We're very happy with the results. 18% in reduction of behaviors, 20% in medications such as antipsychotics. The other thing which is exciting for our category, right? So the type of products for us that we provide is using technology saw financial savings, right? So if you have more questions, feel free to reach out afterwards, but this is less interesting for the purpose of this webinar. So this is how we fare, and if you were to ask me, have we made progress, I am convinced that the work as we do as activity director, on one hand, has gotten more challenging because our residents need us more, but on the other hand, we've made a lot of progress. I firmly believe this. We made progress in understanding how we engage the older adults. We've made some kind of progress in being more respected by other team members, although there is still room for improve there. And I think that we've also made progress in showing through research, through the use of different tools, what it is that we do, how we do it, how do we get credit for our work, and how do we measure and improve. So with that, let's go a little bit into what's blocking us, right? Why is our work so hard, right? So that is the second part of our presentation. And here, I'm going to focus on three things that we're very, very passionate about at Link Senior. And, you know, if these things were removed slightly or much more, our work as resident engagement professional will be much easier. The first one is ageism. The second one is a lack of research. And the third one is just purely a lack of resources and tools for us to perform the basic functionality, the basic things that we should be doing for our work. You know, if somebody would ask me what is the first reason why it's hard to be an activity director today or life enrichment or anyone working in aging, the first reason is that as a whole, our society doesn't respect enough the older adults, right? It's what's called ageism, which is this idea of discrimination against people based on the age. If we, as a society, respected more the older adults, as a society, we would be thinking more often and harder, how can we improve the quality of their life? Now, the exciting piece is obviously things are improving, and I can tell you that 5 years ago, very little people talked about ageism. People are talking about it more and more and more. And you've probably been on some of our past webinars that are still available on the website from Ashton Applewhite or Tracy Gendron from the University of Virginia. Things are moving. People are exploring the idea that aging is cool, and some of you might be aware of our campaign called All People Are Cool. I'll share more details about that at the end of the webinar. But again, the first reason why our line of work is difficult compared to anything else, some of your friends might not be working in aging, and sometimes they might be asking, why are you working in the aging industry? And that is ageism by default. It's, you know, this idea of, again, discrimination. The second reason, and something really important, is why, you know, why aren't our departments more funded? Why don't we have more resources? And the main reason is, although there's more and more research that tie engagement to outcomes, right? Quality of life, clinical and financial outcomes. If I was to, say I'm an activity director and I walk to Megan, who's my administrator, and I would ask her, please double my budget, right? 99% of the time, Megan would just say no, right? As an activity director, we've probably experienced that. I've talked to people who have been 30 years on the job, and it's the constant thing. I've actually met activity directors that would buy things with their own personal credit card because of lack of budget. But what's the reason, right? What is the main reason for that? And that is that as an activity director or a life enrichment coordinator, again, anyone working in resident engagement, it is very difficult for me to explain the value of our work, right, to show what's called the return on investment. And I think, you know, obviously it's a challenge, it's tough, it's difficult, some people quit over that, but I think it's important to understand why it is, right? And that is that Megan, the administrator or the executive director, her imperatives, what keeps her up at night, are things that are driven by the bottom line, that are compliance driven, satisfaction driven, and so on. And again, there is research, but we need more return on investment analysis that show that the more we engage the residents, the better these outcomes. Now, interestingly enough, there's been a lot of reviews on where we stand on that, and some of you might not be surprised that some of the interventions that have the most backing, although not enough again, is things that relate to music. By default, the thing that has the greatest impact on the older adults, especially people that live with some kind of cognitive change, is music. And interestingly enough, as some of you might have experienced, it's also something that is relatively easy to implement, right? As compared to, for example, reminiscing. Some of our activity assistants or some of our CNAs would much rather find music that the residents enjoy and listen to them than try to reminisce over years or periods of time or decades where they weren't even bored or they have no idea. So one, music has a high impact, but two, it's also easy to implement. You know, I think for us as a company, and Erikson and me, myself personally, when I think about what we do as a discipline, it's important to think about what are the things that we're trying to do, right? And the next screen is something that we've been presenting for more than a year now, and that people connect with a lot. And it's a framework that helps us understand how we can improve resident engagement. Essentially, it's kind of a simplification of the description of a job description of an activity director, which is, again, if we want to improve our engagement, what it is that we should do, right? And so the first thing that we should consider is, are we engaging everyone, right? If I was to go to the website of most of your organization, I'm sure that I'll find something that says that once the older adult has moved in your community, regardless of the level of care, there will be some kind of personalized experience, right? And that's a challenge today, right? I'll show some data in a few slides about that. But essentially, there are numerous places today which are unable, that don't have the tools to know in real time if they are engaging everyone, right? Now, some people push back and say, well, we don't want to track attendance, or we don't want to measure that because of reason X, Y, Z. One is activity attendance a good way of measuring engagement? Two, we don't like to count bodies in the room. Or three, we don't want to add work to our teams. Well, I can tell you that we might get away with that, not answering that question today, but not in the very near future for a number of reasons. One is, if we can't answer that question, there's a simple question then that surfaces, which is, well, who have we not engaged, and could these people, these older adults that we serve, be at risk of isolation? And we know that isolation is one of the biggest threat to the quality of life of our older adults. But what happens to their satisfaction, or the satisfaction of their family members, if they would come to know that we haven't engaged them, right? And so that is extremely important in assisted living, in memory care, and in nursing homes, and believe it or not, more and more in independent living. So I think, you know, as we progress, right, there's still work to be done, but it's really important to ask ourselves, are we actually doing this, right? The second part is really the core nature of resident engagement, of activities of programming, is are we building programs based on our residents, who they are, what are their needs, and what are their preferences, and what is the source of purpose, right? What connects them to themselves? And a lot of the discussion that we've had in the past 12 months had been focused on that. And you know, just to give you some perspective, as I said, when I started Erikson, I went through MEPAP 1, really understanding that. But if you look at the job description of an activity director, it actually says that, right? Our programming needs to be based on who the residents are, and obviously in maximizing their well-being and outcomes. Now, why are these questions so difficult? So we did a survey actually trying to find out, and we interviewed, I think, more than 300 people like you to figure out, depending on the level of care, what was blocking you, right? And essentially, I don't think it's any surprise to anyone on the line, what is the most challenging in the line of work is documentation, right? And that is what prevents us from doing what we sign up for the job for in the first place, and why we show up at work every day, which is to engage the older adults, help them find purpose and spend time with them. So documentation, we mean things such as any type of paper or any types of processes. So we went further and asked a question about that in December, I believe it was December. And this is interesting. So we asked, are we tracking attendance, for example, and what kind of activity participation are we using? And as you can see that across the base of people that responded, 75% didn't have a tool to help them answer that one question in real time, that number one there, which is, are we engaging everyone, right? Because if I'm using Excel, the rest of my team, when they input data, it's not shown in real time. We also know that paper isn't great at giving us real-time data because, well, we can't analyze paper in real time. And obviously, there are still a number of us that are not tracking attendance at all. So again, that is probably one of the biggest things that's preventing us, which is how can we get more support, show the value of our work, if we're not even able to answer simple questions such as, one, are we engaging residents, and two, are we engaging them based on who they are, what their preferences are, and what's their source of purpose. So with that, I really highly recommend that we think deeply about our line of work. And anyone that's a rec therapist on the line might recognize this. It's called API, Assess, Plan, Implement, and Evaluate. But essentially, we're very passionate about the fact that we all want to get to know the residents. We all want to plan something for them, to engage them, and to evaluate our work, because that's how we help them find purpose. But again, what's blocking us? And often is we can't think about, quote unquote, prescribing resident engagement, right? And the reason for that is that we don't have the tools, we don't have the resources to do this for all of our residents all the time and show our work. Now, some of you might have noted that I use the word prescribe. We all know, otherwise we wouldn't be doing this work, that most often music in the context of music therapy is better than antidepressants or antipsychotics. We all know that social engagement, reminiscing, even just hand massage is way more effective than any type of medication. The future of resident engagement and what will happen within the next decades, probably even within the next 5-year time frame, is that our discipline is going to become better at what it does. It's going to become better at showing the value of the work, and we're going to become better at collaborating with other professionals so that our work, our engagement, is considered the first modality before medication. So that's extremely important, and we have to think that way, because this is not only the future, it's happening, but this is how we progress, how we improve. Now, how do we get there, which is the third part of our presentation today. And I'd love to share with you things that, one, is foundational to our line of work that people are doing. And so we'll start with this concept of person first. We'll detail a little bit about how can we collaborate better. And three, how can we measure, right? What should we be measuring, and how can we measure resident engagement? So, as you might tell, or I hope you get a sense, is that I'm very passionate about resident engagement. I'm very passionate about the idea of improving the life of the older adults, but I'm not at all the first one, right? And there are numerous ways of doing this, but it starts with this person-first attitude. A lot of us on the line might know or are aware or have implemented person-centered strategy. It's important when we think about it that the very first person to consider that kind of work is somebody by the name of Tom Kitwood. He's a British person. He wrote a book that I highly recommend that we read called Dementia Reconsidered. And he was the first one to really promote the idea that focusing on the disease of somebody living with dementia was detrimental to their health. And not only was it detrimental to the health, but also to the health and quality of the life of the caregiver, of the family, and so on. And he talks about this downward spiral and presented at the time something that was extremely innovative and very, very forward-thinking, which was each person, regardless of the diagnosis, is a person, and that person, even at the very last stages of life, needs to come first, right? And that regardless of the diagnosis, we could still infuse purpose in the life of these older adults. But to start, we had to consider who they were, what was their interests, their preferences, and how can we accommodate in the face of some of the difficulties, whether they were physical or cognitive. On this slide here, I'm sharing with you a list which is not exhaustive. I know there are many other types of methods, but they all take the fundamentals of Tom Kitwood, which is to start with the person, right? In no way am I saying that, first of all, it's alphabetical order, so I highly encourage that we take one or two and we start thinking about it if we haven't already. But what's important is that these models are based on evidence, whether it's research and outcomes. And we have to pick one and start working on it. Or we can design our own, but obviously it's always good to start with something that already exists and is proven. Some of the challenges or some of the things that we have to take into account when we do so is how do we operationalize it, right? How do we train our staff enough, especially in these days in 2020, we're seeing a crazy number of turnover. So how can we provide enough staff training? And obviously, as organizations, how can we work on the financial and the clinical, again, return on investment? What's the impact of these methods? Now, again, I'm going to focus a little bit on one that I'm passionate about because I'm trained in it, but feel free to pick any of these and to consider them. And the one that I'm trained on is the work of Naomi Fowle called the validation method. Her work, and actually she was raised as a kid in a nursing home in Ohio, and her work is how can we help communication with the older adult that is disoriented, regardless of whether there is a diagnosis of dementia or not. And her work helps us build empathy, which is what we need to be able to connect with these older adults. It also helps us understand how can we care for ourselves as caregivers, right? I've spent a lot of time, probably not as much as you, in a assisted living, in a memory care, and in a nursing home, but we know how difficult, how exhausting our work is, especially if we have residents in the face of dementia that have behavior expression, right? It's very stressful. So the work of the Validation Training Institute from Naomi Fowle is not only how can we communicate with the older adults, but also how can we take care of ourselves through centering. Her main, and it's a very rich method. I spent a year becoming a validation worker, so there's probably a lot more than what I'm going to be explaining it to you, but I thought about giving you kind of nuggets of what is important in the work. One of the fundamental of her work is that behind every single behavior of what she calls an old maloriented or disoriented person, there's a reason, right? And that reason often is connected to something in the environment, a current need or preference that is not fulfilled, or very importantly, and we sometimes forget that, something that could be based on an experience in the past. And to explain that and to prove that, Naomi Fowle and the Validation Training Institute use a model, social science model from Erikson that explains what's called the different stages of psychosocial development. I'm sure that you have a story in the back of your mind of a resident expressing a behavior expression such as being aggressive or wandering or just being agitated or aggressive because of something that they experienced years ago, right? And this is explained by this model here where basically at every stage of our life, we're trying to accomplish different objectives, different goals. And if we don't do that, then that might be resurface later in our life through different types of things like depression is very well known. But in the context of dementia, like Alzheimer's, this is sometimes the main reason why we have these behavior expressions. So to achieve that and to help the older adults, we obviously want to think about person first. And to do that, we have to know the residents through different types of life story, life history, any way we can use to understand who they are and what they've experienced throughout their life. Besides that, when we think about person first, right, moving from activities to engagement, it's important that we move as far away as possible from the old standard of activities, the 3 Bs, bingo, Bible, and birthdays. And as I've explained before, one of the first organizations to promote that type of work was the ICA, but that work is actually backed also by the World Health Organization. I'm sure that most of you on the line have experienced, worked, or seen things like this. So there are simple models, mind, body, spirit. Some people have 5, 7, 9 different dimensions. You've probably heard me talk about these in past webinars. But I think that sometimes people forget the importance of not necessarily the number of dimensions, but this idea of being holistic, right? We have to think of what we're providing, our line of work, beyond just one type of program. I'll give you an example, and in no way am I trying to criticize different professionals, but back in September, we were working with an assisted living community, and they changed staff. And the staff before was great, and then the new person was also fantastic, and she happened to be a music therapist. And what happened to the activity calendar is that suddenly more than half of the calendar was musical programs, right? Which is great because actually it was slightly better than what was on the calendar before. But that begs the question, right? How many of these programs were based on needs and preferences of the residents? And so I think it's important to think about what the residents need, where our strengths are, but how overall can we be as holistic as possible. So together, we reviewed this concept of person first. I'd love to then get into how can we apply some of these things. And the big word here is collaboration, right? If we want to think about our work, moving from activities to engagement, we have to collaborate with the older adults that we serve, right? If you look at the definition of engagement, it's providing a stimulus, but it totally lacks the idea of fulfilling purpose with the older adults. And to do that, we have to, quote unquote, collaborate with them. So that means, when they can, that we listen and we spend time understanding what their needs and preferences are. Obviously, there's a big question, which is, well, what do we do in the event that the older adults, the residents we serve, cannot do that, right? Cannot express or tell us what they've done throughout their life or what their current preferences are. And there are a number of ways of doing that. Obviously, one can engage with the family or friends of the older adults. Sometimes we might think about what has the person experienced in terms of past activities that they've enjoyed. A lot of our work is fact-finding, doing our detective work. But I think that often one of the most untapped resources is other teams, whether it's from dining services or our nursing assistant. They sometimes spend more time than us with the older adults. And I know as a fact, because I've talked to numerous providers, often they've already identified the fact that collaboration with other teams is what is preventing them from doing better work in engagement. And so the question is, how can we invite and have other of our team members help us, right? And I think the first thing is to move from activities to engagement. We cannot do it alone, right? We as activity professional, anyone working in resident engagement, we cannot do it only with us, our team, or our department. It needs to be something that a whole organization values. So the third part about measuring is probably going to give you some advice on how to talk to your executive director, your administrator, your CEO. But I can tell you that to invite, collaborate, and have an interdisciplinary approach to resident engagement, we have to work as the leader of our organization. We were joking a few months ago at Link Senior, thinking that activity directors should consider themselves as CEOs, right? Not chief executive officers, but chief engagement officer. We are the best at understanding who the residents are, what we should be providing them so they can find purpose, and doing that source of purpose, that work, every day for all residents. We are the best at that, so we should be the leaders in explaining how other departments can work with us, support us, and assist us. So to do that, obviously programming, our line of work, needs to be recognized, valued, and respected. And the true enabler of this conversation, and we've seen that with many different providers, is data, right? We have to find ways to take credit for our work, right? We know that activities, resident engagement is tough. A lot of us do it because we're passionate about doing it, right? We show up at work because we love spending time with the older adults, engaging them. We might be even able to find a high-paying job in other industries, but we do it because we know it matters. To enable that across our organization, we have to think about getting credit for that passion that we have, right? Which is the third part of our presentation, and something that I'd love to go into further detail with you. So as a general line of thought, I think it's important to think conceptually that when we measure something, by default, it tends to improve, right? And again, there's a lot of debate whether do we track attendance, how do we do it, and so on and so on. But I can tell you that it's important to think that if we're not, we're probably missing on something. And if we start measuring it, even if the measure isn't great, it gives us ways to improve and show what it is that we do. So again, if we do that, it is the true enabler to these three questions that I've explained before, right? Again, we see numerous places where the activity director is a true expert, passionate about her work or his work, and she or he can tell you how they've engaged, say, 20 or 30 residents. There might be other 20 residents that we kind of have an idea, but it's impossible for us to know about 50, 60, 110 residents. So data is what enables us to do that. As I said, we've seen tremendous improvement in these concepts, and I'd like to share with you where we believe as a company things are going and what is happening now. We believe, and note my words on that goals around resident engagement should be in the coming years to target different, quote-unquote, percentage of population engaged. Right now, by default, we work with a target of 85%. What does that mean? That means that in the next 2 or 3 years, especially in assisted living, memory care, and the nursing home environment, people are going to start thinking about how much of our residents have we engaged, where do we stand, and what is a good goal, right? And we've put forward the goal of 85% for a number of reasons. Sometimes our residents come and go. Sometimes they are difficult to get to. We have staffing issues. But overall, we believe that the industry is aligning itself on a target of about 85%. I'll tell you next year what our fine-tuned assumption is, but this is what we're seeing. That is a big undertaking, especially for the people that are using paper or that are not tracking attendance. But again, this is us thinking about resident engagement for the coming years with an S. We believe that us, activity professional, resident engagement, we are working towards a percentage of a population engaged, right? And right now, 80% is what seems to be a good assumption. The second thing, and that's really important, is appropriate use of one-on-one and interventions. As we know, there are many different ways of conducting activities, but if we think about the type of activities, like in terms of staffing and number of residents, We could either do groups activities, so more than one resident, or we could do one-on-ones or non-pharmacological intervention. And one of the biggest needs that we see in memory care and in the nursing home environment is that we're not doing enough one-on-ones and non-pharmacological intervention. And it's great to say that, but it will never change unless we start measuring that. So for us to get to the point where we can comfortably say, yes, we're doing an appropriate number of one-on-ones and non-pharmacological intervention, we have to think about how many are we doing today, how many do our residents need. And the last thing is measuring our staff. And in no way am I saying we should measure our staff to cop them around. We should measure our staff to help them be better at what it is that they do. We see a number of clients and staff that we work with where some of the staff, what they love is doing one-on-ones. Some of them, they're kind of chi-led leaders type. They much prefer being in a large group. We cannot support our staff and give them the tools they need unless we know who is best fitted for what and how can we accomplish that. So again, I know that some of you might be very interested in these discussions. Some of you might be thinking, well, how do we achieve that? I'm happy to, after this webinar, respond to any question. Actually, I think we have a little bit of time for Q&As, but if you have any questions, feel free to reach out any time to us. But I think that people that believe that the future does not hold a measure, they're kind of lying to themselves, and sadly, they're probably not getting credit for their work and therefore cannot really improve what it is that they do. So I highly encourage you to think about this. If you believe that these are crazy, I'd love to talk to you. And if you think otherwise, feel free to reach out. So with that, I'd like to invite you to two things, which is one, something that you might be familiar with, which is a huge campaign that we started at Link Senior 2 years ago that is fun, it's an engaging, and it's a great way for us to discuss things that are important, and it's called the Old People Are Cool campaign. There's a website called oldpeopleare.cool. You're more than welcome to visit, engage. You can buy things on the store. We give money to the Alzheimer's Association. And the second invitation I'd like to present to you is our future webinars. Again, we're very passionate about you, what you do, and how can we help you improve every single day. And so we know that education is sometimes the limiting factor, hence why we put these free webinars. As you can see, in February, we'll be highlighting some of the work of our clients. It's a little bit like what we did in October. We're inviting people that have corporate responsibility so that we can hear from them what are their goals when they support their communities and their staff, what they want to see, and some of the best practices they have. Again, thank you very much for joining. Here's my email. Feel free to reach out any single time, anytime you want, and I'm happy to answer any questions if we have some.
Thank you so much, Charles. One question we do have here is about how do we make sure that the activities department isn't the only department driving engagement? So you talked a little bit about this interdisciplinary and collaborative approach. Can you elaborate on that?
Sure. I think, as always, it's very important to understand what are other people trying to do, right? So, for example, nursing has different sets of objectives. Our administrators or executive directors, they're not measured the same way. So we have to understand what matters to them. And given the research and given the data, and again, this deck will be made available, you now have the tools to explain how important your line of work is. I think the second thing that is important is, most often, typically a CNA, they kind of like working with the older adults. Not all of them, but a lot of them. But what happens is often they're scared or they don't know what to do. And I think that spending a bit of time with nursing, helping them understand what engagement is about and what to do about it, it's the first step. The second thing I'd like to mention is at Link Senior, we built these dementia cue cards to help people understand behavior associated to dementia. And we have a free PDF that is a fantastic enabler of discussion between nursing and activities.
Another question we have, Charles, is, does it matter if we can't engage a resident? What are your thoughts on that? I
can't. I think I think our line of work is about trying, right? Is a perfect engagement by default is almost going to be impossible. It's, my wife is a teacher, perfect teaching is almost impossible. Our line of work is to try to provide the best source of purposes. So I think there's a number of reasons why we couldn't, right? Some people just refuse our program all the time. Sometimes we can't find the resources. What we have to do is try our best to do it. And actually that's what, from a compliance standpoint, in the nursing home setting, this is what we have to show, right? We have to document that we've tried, and I think that often a family member might understand, but to be able to have these good discussions, we have to, again, get credit and document the fact that we've tried. So I think that in the context, I think that yes, it's okay, but we have to document and show what we've done.
And one final question we have here is, when the nursing department works with the activities department, what kind of data points do they want from the programming team?
Well, I think that most nurses, in the context of memory care or long-term care, they're going to be very interested in things related to behavior expression. So every time we use a non-pharmacological intervention, we have to show it. To be honest, I still don't understand. Well, I know there's a number of reasons, but where I would challenge a lot of activity directors today is, are they truly capturing every single time we're helping a resident through behavior expression? So I think that nursing is very interested in that, because that has an implication on nursing processes and workflows. I think nursing is also interested in things that help them do their work better, right? So for them, it's all about improving outcomes, reducing risk, whether it's clinical or compliance. Here's a picture of Max, my son. Why are we? That's one of the things that you can buy on the Old People Course store. Wait, the last question is, as I come back to the last question, I think that nursing departments are also interested in us showing that we've engaged all of our residents. It might not be the data point that they're looking forward or when they look at activities, but I can tell you that most nurses understand the risk of isolation and the risk of being disengaged. So if we take a proactive approach and we show that we've engaged all of our residents, or tried to at least, that is probably very, very good.
Excellent. Thank you so much, Charles. And for those of you who have joined us today who are looking for CEU credit, I'm going to put the survey into the chat box right now for you to fill that out. This is a mandatory survey that needs to be filled out if you want CEU credit by midnight this Thursday. And as Charles mentioned, in the constant contact email message I send today, I'll also include a link to the PowerPoint slide deck so you can see that as well. And we just want to thank you for joining us today, and we hope to see you next month on February 18th for our next webinar, and have a great afternoon. Thank you.
Thanks, Megan. Thanks, everyone. Take care. And more importantly, enjoy what you do. Enjoy what you do. It's a fantastic industry. It's a fantastic discipline, and there's a lot of opportunities for line of work. So again, feel free to reach out. Good luck. It's not easy every day, but trust me, things are improving, and our work is being more and more recognized. Have a good day, a good week, and fantastic 2020. Thank you.